Here we have seen all various in vivo techniques. Most of these are there, like radiant heat, then electrical stimulation, grid shock, tooth pulse stimulation, and most of these they are giving the indication whether the drug is acting on opioid receptor or not, because this is these all tests are there, and there were some tests which we have seen. They were for the this NSAID related activity, like writhing test, pain in the inflamed tissue, okay, mechanical visceral pain in the rat. So these were different effects which we have seen. Now, as I told you, there are plenty of in vitro methods. There are so many in vitro methods, and I told you basis of in vitro method. Basis of in vitro method is what? Basis is very clear that either we are having receptors, either, and on that we are having a radio labeled agonist or antagonist, and we are observing the binding, we are measuring the binding is one thing. Second thing is cells are available, and on cell when our drug will be acting, and therefore because of that whatsoever changes are there, they can be recorded either by fluorescence or by various methods. So this binding we can see. This is another way. So we have got cell based assay, we have got enzyme based assay. These all are in vitro, or receptor based assay where radio labeled agonist antagonist are binding. And as I told you, in inflammatory process there are so many components are there. So all these components, when we shall see, there are so many chemokines and inflammatory mediators are there. So if we are studying, we can get several such studies. We can see one by one like that. I'll not go in detail of each because it's very, very long and lengthy. So this is what, there are so many in vitro methods, as I told you, for anti-inflammatory. For that, basis is very clear. Basis is that for inflammation there are several contributors, several participants, and those who understand physiology, those who have seen it in pharmacology, they can understand that how big it is. So here we have got agents. Here 3H, you know, now we have seen since many times. 3H means it is a radio labeled, okay, so radio labeled bradykinin is produced, and we are studying the binding studies for that, okay. Receptor binding. Then substance P and the tachykinin family, we are studying its binding with cells and receptors. Then 3H, again it is a radio label studies, and in that this radio label studies we are seeing that how it is acting on P receptors. Just a minute, please hold. बोला हाँ, मी बघून आलो तिथे. तो मी केलं आणि बारा वाजता का आणले म्हणजे, तर तुम्ही तर सकाळी म्हणा माझं नाव सांगा. सकाळी तुम्ही नाही म्हटले होते करायला, आम्ही जबरदस्ती केली. काल तर ठरलं होतं आपलं घेऊन यायचं म्हणून. काल तर आपलं मीटिंगमध्ये पण ठरलं होतं, पण ठीक आहे, तुम्ही थांबले तर 2 तासाने काय फरक पडला एवढा. ठीक आहे, आपण काही इलाजच नाही, सगळं करून घेणं आवश्यक आहे. आता काय करता तुम्ही, एवढ्या दिवसाचं पेंडिंग एका दिवसात कुठं नाही. ते सगळं एकदमच अवघड जाणार नाही असं बघायचं, बाकी काही नाही. बघा, मी माझ्या हाताने सगळे माझं साफ करून घेतलं सकाळी, माझे सगळे हे करून घेतले. आणि मी मागे पण जरूर पडलं तर खिशातले पैसे देऊन जाळ्या वेळे बघा माझ्याकडे एवढं एकच जाळं राहिलं, तेवढं फक्त त्यांनी काढलं म्हणजे झालं माझं. हां, ठीक आहे ना, म्हणजे पण तेवढंच एक जाळं राहिलं माझ्याकडे बस. ओ यादवजी, यादव बस हा त्याला सांगतो ना एवढं फक्त काढून दे म्हणजे माझं कामच झालं, मला काहीच नाही माझ्याकडे. Hello, let us continue. So these are acting on various receptors. Then we have got agents which can again acting, that is radioligand on substance P. Substance P is also one of the contributor of inflammation. So we are studying its binding. Then neurokinin receptor binding we can study. We can see the characterization of neurokinin agonist and antagonist by biological assays. There are various ways by which we can do. Then if you know that there is a chemotaxis which is taking morphonuclear leukocyte means what? Anybody knows? What is polymorphonuclear leukocytes? Can anybody tell? Hello? Am I audible? Okay. That means you do not know polymorphonuclear, isn't it? मालूम नहीं है ना तुमको? Hello? Okay, first. These are the neutrophils. Since neutrophils are having different kind of shape and particularly the nuclear structure that can be modified, therefore it is called as a polymorphonuclear. So that is nothing but what? Neutrophils. So these are the neutrophils, and which are very, very important. You know, around 75% are the neutrophils in WBC, which are taking part in the inflammatory or in the immune reactions. So these are the agents. Then again polymorphonuclear leukocytes aggregation, which is induced by this chemical, is there, FMLP, which causes its aggregation. Then next is constitutive and inducible arachidonic acid metabolism. So we know there are two types of enzymes, that is COX enzyme, constitutive COX and inducible COX, and we can study it in vitro whether this arachidonic acid metabolism is blocked or not. Formation of leukotriene B4 in human WBC in vitro, that test we can make. Leukotriene B4 we have seen it is playing important role in various inflammatory activity, including asthma, it is playing role. Then next is formation of lipoxygenase products from 14C. 14C is again is a radioligand. So radiolabeled arachidonic acid in human polymorphonuclear neutrophils. Okay, these are called as a PMN. Very commonly word is PMN in vitro. Formation of eicosanoids from again 14C arachidonic acid in human platelets in vitro. Stimulation of inducible prostaglandin pathway in human polymorphonuclear nucleosides, that is PMNL. Then COX1 and COX2 inhibition, okay, that can be there. Then induced release of cytokines like interleukin 1 alpha, interleukin 1 beta, interleukin 6, interleukin 8, TNF alpha from human WBC in vitro. Now this is very old one. As I told you, if you remember, I told you that even now we have got antibodies for interleukin 6, tocilizumab, that is monoclonal antibody. Now accordingly we can have so many antibodies. As I told you, this book is very old. So there are so many such assays which are available, which can be there. Then flow cytometry is one of the methods. Just like analytically you have got HPLC and different methods, similarly it is a flow cytometry. That is there is a flow of fluid in which cells are flowing, and we can check the fluorescence phosphorus of the cells. So these are the flow cytometric analysis of intracellular cytokines. That is, we can add some chemical, and because of that there can be some phosphorescence or fluorescence, and because of this phosphorescence fluorescence we can detect that what is happening to the intracellular cytokines. Then at TNF alpha antagonism we can check. Then binding to interferon receptors, that is how our agents, whether it is agonist, antagonist, they can bind to the interferon receptor, what will be happening to that. Then screening for interleukin 1 antagonist, that we can check. inhibition of interleukin 1 beta converting enzyme, because interleukin has to be converted and activated, just like angiotensin we have seen in blood pressure. Similarly, it is important. Then there are many other in vivo methods for anti-inflammatory testing, and these are various chemicals. If you remember, again we can see some of these. So let us go for that. Some of the in vitro studies, in vivo studies, how we are going for this. Okay. So first is ultraviolet erythema in guinea pigs, that is with the radiation with ultraviolet rays. What we will be doing is the guinea pigs will be from male female, they can be taken chemically depleted by depilated. You know depilation, what it is? Depilation means, what is depilation? Anybody know? सुटिक्स में, कॉस्मेटिक्स में कभी डेपिलेटरीज चैप्टर पढ़ा है? डेपिलेटरीज व्हाट इट इज? वेरी गुड. तो ये इसका मतलब समझ गया ना. देन दे आर केमिकली डेपिलेटेड बाय कमर्शियल डेपिलेशन प्रोडक्ट और बेरियम सल्फाइड, है ना. दिस इज व्हाट डेपिलेटेड. देन द पेस्ट एंड द फर आर rinsed, all the hairs are removed, okay, and accordingly the test compound is applied, okay, and then it is administered and ultraviolet exposure is done. Actually we measure here the phototoxicity, okay, and what will be there. So these are the ultraviolet burners are there, and accordingly this ultraviolet inflammation or burning is produced, and accordingly we say that 0 is a no erythema, 1 is weak erythema, 2 is strong erythema, 4 is very strong erythema, and accordingly we can go for that. There are many modification for that, and there are some people have checked about steroids on that, whether they are useful. Then the ear temperature, water content of the ear, they are checked. Then instead of fur removed, they can be tested on ear only. So these are some are instead of guinea pig they are use rats. Then they have some of these they are used on the hairless mice. So these are various ways by which it can be there. Then next type of in vivo activity is vascular permeability. Now the agents, you know, wherever there is a inflammation, they increase the vascular permeability, and these agents are what? Histamine, prostaglandins, leukotrienes. They causes the increase in the vascular permeability and their dilation of blood vessel. Because of that, the proteins they go to the extracellular fluid and they have their osmotic pressure over there, and this can cause the problem. So these are various tests we can have. That is, what we'll do is the ventral side of the animals are shaved, okay, or depilated, as we have seen. 5 ml per kg of 1 ml solution of Evans blue is injected intravenously, and after 1 hour the animals are dosed with the test compound orally or intraperitoneally, and we shall see that what is happening to Evans blue in that, okay. So the diameter of the dye infiltrated area is measured in millimeters in 2 perpendicular directions, and mean values will be taken. So this is shows that if there is a vasodilation, then dye will be going into more area, okay. So these are various methods which are used for that particular purposes. Then inhibition of leukocyte adhesion to rat mesenteric venules. So what we are doing in this is we are using Sprague-Dalley rats. They are anesthetized by administration of Nembutal. It is one of the barbiturate. Trachea, jugular vein, they are cannulated, abdominal cavity is opened and the section of ileum is pulled out, draped over the heated microscope table. Here we can call it as a XYO. Okay, XYO का example है ये, because the ileum is there inside the body. Actually it is not totally removed, but at the same time it is not an intact body. Prior to test compound, the number of spontaneous adhering leukocytes are counted. Okay, and this is how the test is done. The chemical, that is FMLP, we have seen earlier also. So this FMLP is added, and accordingly we can check that what is the that is the blood, that is adhering leukocytes, how many are there. So this number of leukocytes will be checking in the mesenteric venule section, is counted 30 minutes after the stimulus is given, and we can check the impact of drug, test or standard drug, what will be the effect of that. Then next is oxazolone induced ear edema in mice. We have seen earlier oxazolone is one of the very popular inflammatory agent. So what we can do is mice will take and 2% fresh solution of oxazolone in acetone is prepared. The mice are sensitized by application of 0.1 ml of the abdominal skin inside the both ears under the brief halogen anesthesia, and after 8 days later again this anesthesia is applied and oxazolone is applied. You know, for immune reaction we need to introduce antigen first, so that the body can generate antibodies and memory is developed. So we are doing this, we call it as a priming. So this priming is done, and later after some time we are again injecting this, and then because of that the inflammation will be produced. So the average values of the increase of the weight are calculated for each test group and comparatively statistically. Okay, so this is how we are, that is weight of ear actually we are measuring, and accordingly we can see the impact of that. 1% indomethacin was found effective, that is NSAIDs are there, and also 0.03% hydrocortisone, they are useful. So it is giving test for both steroidal and non-steroidal anti-inflammatory. So this is one method. There are many slight modifications of these methods are there on ear. Then croton oil is again very famous test for edema. It is the irritant oil. So this irritant is having, that is 1 part of croton oil, 10% ethanol, 20 parts of pyridine, and 69% of ethyl ether. So this makes the croton solution, and in that croton solution, this croton solution can be given. This test rats we are giving, and different type of rats are there, that is NMRI mice can also be taken, or normal mice can be taken, or Sprague Dawley rat can be taken. Any type of animals are there, we can take them, and we'll do what is, we'll apply the irritant on one of the ear, that is right ear 0.1 ml and left ear, and control receive only only the irritant, while the other receive treatment also. And 4 hours after application, animals are sacrificed under anesthesia, both ears removed, and the disc of 8 mm diameter they are punctured. They are weighed immediately, and the weight difference between the treated and untreated rat, because treated will be more because of the edema and inflammation. So accordingly we can use it, we can understand this. So this is determined by expressing the increase in the weight of treated ear versus untreated ear, like that, and accordingly we can have the data. Again it is found that hydrocortisone is found to be effective in that. That means this gives good results with the steroidal anti-inflammatory agents. Then next are many such chemicals, many compounds are there. There are so many compounds which can be used. Okay, and accordingly we can go for test, and even we can use different animals also, like white rabbits we can use. Then there are apparatus are made to measure crotonal induced ear edema in mice. Okay. Then instead of that, Staphylococcus aureus can be given in addition to crotonile inflamed skin, and we can check the impact. Then toxic contact reaction to contactile or dinitrochlorobenzene, that is GNCB, or allergic contact reaction can be checked. So these are the slight modification which are there, which can be made. Then next type of is paw edema, very common. For that, if you remember, I told you about a instrument which is used, we call it as a plethysmometer. So plethysmometer is used, and there are so many phlogistic or irritant are used. Example of these are brewer's yeast. We have already seen brewer's yeast was used for pyrogen temperature testing. It can be formaldehyde, that is formalin. If you remember, we have seen dextran, we have seen egg albumin, kaolin, aerosil is branded product, sulfated polysaccharide like carrageenan, or naphthyl heparamine. So these are so many chemicals are there. Any of these chemical can be used. They are injected in the rat paw, and on this rat paw we can insert it, and that will cause particularly the inflammation in that paw. The instrument you have that will measure it correctly, and you can check the paw volume at different period of time. If you remember, we have seen that we get two kind of activities, or two sets of activity, okay, because of the release of various chemicals. So these are so many molecules are there, they can be tested, and there are many plethysmometers are developed, that is called as a plethysmography of the paw. So the old one where the mercury one, latest are the electronic devices. Very popular is Ugobacil instrument that shows. I'll try to put all the links, or if possible you can also search. There are so many, see this many phlogistic agents are available. Phlogistic agents means these are the irritant, okay, these are which will cause inflammation. So what are these? You can see this: undiluted egg white, O-albumin, formalin, carrageenan, then carrageenan solution plus prostaglandin E2 or PGI, dextran solution, brewer's yeast, naphthyleparamine, trypsin solution, collagenase solution, solution of collagenase again, which is from different, that is Clostridium histolyticum, then 100 unit of hyaluronidase, complete spreads adjuvant. This is used for even producing arthritis. Okay, this is very popular model for arthritis model. Then 0.0% serotonin solution, 0.005% bradykinin solution, 0.1 milligram per ml prostaglandin, 0.2 microgram per ml prostaglandin. So these are various, so many solutions are there which are used. Okay, and accordingly we can go for observing measurement of the paw edema, and we can test the impact of it. Just hello. Huh. हां, पहिला टॉपिक. हां, तुम्ही सांगा ना पुढच्या वीकला कधी, मला काही अडचण नाही. फक्त 1 तारखेला मी आउट ऑफ स्टेशन आहे. एक सोडून काही सांगा. हां, चालेल ना, 7-9 काही अडचण नाही, काही अडचण नाही. ओके ओके, चालते. थँक्यू. ओके, चालते. थँक्यू. हॅलो, बोला डॉक्टर. प्रणिता पटणे. बरं. चालेल ना. मग त्यांना अडचण येते का काही घ्यायला, की सांगावं लागेल मला? हां, बरं बरं, मग त्यानं तसं सांगा एक त्या मुलाकडनं पण लिहून घ्या म्हणून एक एक ही म्हणून काय म्हणतात त्याला हे म्हणून काय म्हणतात स्पेशल केस म्हणून करून घ्या म्हणून. सांगू का मी? कोणाला सांगावं लागेल? दोन शाखा, हां कॅशियरला सांगू का यांना सांगू? बरं बरं ठीक चालतं, मी बोलतो त्यांना. ओके. शेळकेजी ते राठोडजींचा मला फोन होता, एकच विद्यार्थ्याची आहे ना, घेऊन टाका ती, त्याला स्पेशल केस म्हणून अर्ज घ्या त्याच्याकडे की माझं कुठेच होत नाही आहे, तर माझी एवढी कॅश घेण्यात यावी म्हणून. हां अर्ज घ्या किंवा मी ऑनलाईन प्रयत्न केला पण माझ्याने होत नाही आहे म्हणून मी कॅश आहे, मला एक काय म्हणतात त्याला विशेष बाब म्हणून परवानगी देण्यात यावी, मी पुढच्या वेळेसपासून प्रयत्न करेल की मी ऑनलाईन बरोबर भरेल म्हणून. ते सगळं त्यांच्याकडनं लिहून घ्या ना, सगळं स्टुडंट सेक्शनकडनं आल्यानंतरच घ्या ना तुम्ही, त्यांचं रिकमेंडेशन असलं तर ते घ्या, त्यांचं अर्जावर रिकमेंडेशन घ्या एवढे पैसे घ्या म्हणून. मग तुमचा प्रश्न, तुमचा फक्त पैसे घेण्याचाच प्रश्न येतो, आलं का लक्षात? तुमचा मग बाकीचं बघायचा प्रश्नच येत नाही ना. त्यांच्याकडं रिकमेंडेशन घ्या आणि घेऊन टाका, चालतंय. नाही ते म्हटले मला, त्यांचा फोन आला, खूप प्रयत्न केला म्हटलं पण नाही होते है ना. मग स्पेशल बाब म्हणून करा आणि त्यांच्याकडून नोट घ्या एवढे पैसे घ्या म्हणून. तुमचं का तुम्हाला रिस्क नाही, त्यांना बघितलेलं असतं ते सगळं. ओके. Yes. So these are the paw edema. Paw edema is very very famous. There are so many. Only thing is injection we can give any. We have seen around 10-15 types which can give the injection. However, the machine is similar. Machine is, that is, we call it as a plethysmometer. I'll try to put it how it is there, inflammation and plethysmometer. So that measures the change in the volume, and accordingly you can get different results, and you can see that what are the impact because of various agents. Then pleurisy is one of the thing. Pleurisy is exudation that happens, particularly it is in lung etc. It is there, that is the fluid is secreting, that is oozing out. Okay, it can be induced by several irritants like histamine, bradykinin, mast cell degranulators, dextran enzymes, antigens, microbes, carrageenan. There are so many things are there. Just a minute. एक मिनिट, गुडकेजी या ना, यादवजी रूम सगळी साफ आहे, फक्त तेवढं जर तुमच्याकडे लांब असेल ना तेवढं एक काढून द्या बस, फक्त तेवढंच काढून द्या, काहीच म्हणजे रूमला बाकी काहीच करायची गरज नाही, तेवढंच फक्त. So these are the various agents, and carrageenan is very very popular one. Okay, now I am not going into detail. Normally in pharmacology we teach that carrageenan, there are so many varieties of carrageenan. Out of that, carrageenan lambda is only active. Okay, other carrageenan are useless. This is, I will not go for this much details for you people, but these are the activities which are very important. The animals are lightly anesthetized, they are placed on the back, hair is removed, and the region is swabbed with alcohol. The small incision is made into skin under the right arm between the 7 and 8 rib. The wound is open. This is called as a wound healing technique also, and it is exposed to this intercostal muscle. Carrageenan solution is injected into the pleural cavity. Pleural cavity, you know, that is lungs are protected with the pleural cavity, lung and all. So this is pleural cavity we are injecting, and because of that inflammation will be there, and it will be causing the secretions from that. Okay, so 1 hour before carrageenan injection and 24 to 8 hours after, this treated with the standard or test compounds, depending on your protocol. You can do it early or you can do it later, you go for that. And the animal are placed on dissection box, forelimbs are fully extended, incision is done, that is zyptosternal cartilage that is made free from the connective tissue, and you are checking the fluid, so you are measuring the fluid. So what you are doing here, you will do this Hanks solution is there, is subtracted from the measured volume. Suppose you are adding 1 ml into that pleural cavity, and then you are checking back, so that 1 ml is again reduced, and then volume of each experiment you will see that how much fluid is secreted, oozed out. And again WBC you are measuring in the exudate, the pleural fluid is there, using Coulter counter or hematocytometer. You can use any machine, because if you are having your good laboratory, then it is automated laboratory. If it is not, then you can do it. So this is how you are going for the measurement. This is how the things are there. Then next type of that, as I told you, very big chapter, granuloma pouch technique. Here what you are doing is, you have these animals are there, the back of animal shaved, disinfected, a thin needle. This pneumoderma is made with the needle, that is you are making the injury with that. And these oval air pouches are there. You are either making air or 1% croton oil solution in the sesame oil you are making, and this 48 hours later the air is withdrawn from the pouch, and you see that what are the adhesions are there, what are the inflammation they are produced. So what you are measuring here, the average value of the exudate of the control and the test group is calculated, comparison is made, because it will produce exudate from that, that is pus जैसा fluid जो बाहर निकलता है, we call it as a exudate. So this exudate you will be measuring, and accordingly you will get the idea about it. Okay. Now there are many other methods are there, particularly for this urate induced synovitis, that is synovial joint inflammation is there. You can do it with the urate. This is again inflammation, particularly of synovial joints. I told you one more method, that is friends adjuvants, that is causing the arthritis like situations. So these are so many models, as I told you, they are present, and these models are in vivo models. Then another method is there, proliferation, that is whenever there is inflammation, proliferation is occurring. So that is a very again popular method is there, that is called as a cotton wool granuloma. What will happen that you take the weighed amount of, that is 1 gram of cotton, or 100 milligram of cotton, and you see that what are the attachment, adherence of cell to that. Okay. So what you are doing is, the rats are taken, skin is shaved, disinfectant, incision is made, and with the blunted forces tunnels are formed, and sterilized cotton pellet is placed both sides of that. Okay. Pellet is either standardized, weighing 20 milligram, or pellets from raw cotton, which produce more pronounced inflammation than bleached cotton. The animals treated for 7 days, and you can see that what has happened to the cotton weight. So weight of the pellet cotton you can take, and accordingly if there is a granuloma, if there is a more proliferation, the weight will be increased, and if your drugs are there which are anti-inflammatory, they will reduce this inflammation. So this is very good method for evaluation of steroidal and NSAIDs. This test can be formed with the if you want to study the corticosteroids, because there is normal secretion also from body. So it is advised that these rats, animals, the cortex, adrenal cortex to be removed, so that no glucocorticoid are released, and only whatsoever you will get, that is the effect of the drugs. So these are various methods which are there. Then sponge implantations technique, just like cotton, instead of cotton we are inserting sponge inside that there. So these are the disc of 5 mm thickness we can have, that is polyvinyl foam sheets, and they are punched inside the standard size and weight. So this is around 10 milligram accurately weighed, and they are having perfect size. So these sponges are soaked in the ethanol for 30 minutes, rinsed 4 times, and heated for 80 degrees Celsius 2 hours. They are soaked in the sterile 0.9% saline with either drugs, antigens, or irritants, and then accordingly you can see the change effect. What are the, just like cotton we are weighed, similarly we are going to weigh this sponge and we'll see the effect. What are the various things which are there, which are caused. Glass rod granuloma we are having. I think you might have wondered that so many tests are there anti-inflammatory. Even if we want to describe, then whole 45 lectures will be insufficient to describe this anti-inflammatory. It is so big. Okay. So glass rod with the diameter of 6 millimeter are cut to a length of 40 millimeters. The ends are rounded off by flame melting, and they are sterilized, and they are implanted in the rats, okay, in the back skin, and we'll see the what kind of tissues are there to that, and we can just check these tissues for the activity. Then ulcerogenic effects we can see, that is this is we'll see later in GIT, because this is the adverse effect of NSAIDs. So as I told you, we are not going to study the adverse effects. We have seen same thing in the CNS. Here also we are not going to study any kind of habit forming or ulcerogenic effects. We are not going to see it. This is again we are not going to do. Determination of blood loss we are not going to do. Antipyretic already I told you, that is we are injecting this brewer's yeast, and there are the thermoregulatory, these are the thermometer, rectal thermometer we call them. So this rectal thermometer will be inserted and will take the temperature. It's simple, and we'll administer the drug and we'll see that whether this temperature can be controlled or not. We have seen it similar to that of pyrogen. So similarly here it is also similar to that of pyrogen testing in rabbits. Same test we are following over here. Only thing is, instead of pyrogen we will be giving our test compounds. So this is what about our drugs, that is anti-inflammatory agents, analgesic agents, and antipyretic agents. Okay. Please note that we have covered only pure activities. We have not covered the adverse effects related studies for that, and we have covered it in fast, because so many anti in vivo and in vitro activities are there. I repeat, this is very old book, very old edition, and there are so many new additions to this are there. We are not going for this much details, but if you are making it in a tabular form, and if you are understanding the basic concept on which the in vivo or in vitro are made, then it will be easy for that. So go for that. You can make your own way for the writing, so that you can remember and you can understand. So all these tests we have seen, these are anti-inflammatory, analgesics, and antipyretics. So if you have any difficulty, you can ask at any time. Please go through simultaneously and keep on making your notes, because I will not again and again give as assignment. The assignments I have given just to check, but whether you can do it or not, once I know that you can do it, you should do it, even if these are not assignments. Okay. So instead of giving assignment, I am putting it to yourself, whether you want to do it or not, you can do it or not. So take care and be safe. Okay.